how a holistic tech approach enabled an island to manage a pandemic.
Mela, they say that they leave the best for the last. And I think we did with this panel, I'd like to say that it gives light a bit to a lot of background work that happens on a national level to protect our nation. It's that serious. And here we have with us today Nicholas, who is an enterprise architect with the MITA Health team. So all those different digital personal health records, such as My Health, he keeps that, he's one of the people who keeps that running. And then, apart from that, we also have Robert Muscat, who is a specialist in cyber defense and advanced operations, both working at MITA. Now, like, this is an extremely important thing to mention. When we have health infrastructure, we truly need top-class security, as Minister Fern pointed out this morning. And I want to ask both of you. The COVID-19 pandemic has put us in crisis mode. There's no doubt about that. And I want to ask you, how did MITA respond? How did it feel to be part of MITA during this COVID-19 pandemic? Maybe we start with Robert first, and then Nick. Try again. Just one moment.
Hello. All right.
Thanks.
So, basically, from our end, as with everyone else, it was a challenge. We basically shifted all our teams, basically reassembled each and every personnel into 3 different teams to manage the influx of calls that we had due to the changes that occurred in every part of the infrastructure of the health environment. And after we did that, we could basically elevate the security alerts on all basically health platforms, so as to make them as sensitive as possible, so as soon as we had small indications of either compromise or unusual behavior on health platforms, we could action swiftly as much as possible.
Rob, like we can have some room for flexibility today. So I just have to have like a counter question, not a small one. Did this result in like alert fatigue at some point? All these different, and how did you counteract that, and what did you learn from that?
So, very valid question. The investment that MITA and also the government of Malta has made in the recent years, we've invested not only in human resources, but also through tools which facilitate and prioritize the alerting mechanism through the use of also technologies such as artificial intelligence. Having said that, yes, there were instances where we did have resource fatigue, but we did also plan for that previously in case for different services as part of our business continuity and disaster recovery exercises that we do for the government of Malta. What I also wanted to add is that through our tools, we didn't only keep visibility of the security posture of the health platforms, but we divested that to MITA's health team so that they could basically monitor the security posture that includes the different vulnerabilities, the different possibilities of misconfiguration, so that they could tweak accordingly and be prepared as much as possible for the worse because there was high focus from attackers given the importance that the pandemic brought. So we were basically prepared as much as possible because we could feel that there was high focus from attackers attacking health infrastructure.
Yeah, there were more people at home, people spending more time on their computers, on their devices, on their smartphones. So obviously, there's going to be a higher concentration of attacks. I want to talk to Nick now and walk us through, Nick, through your experience with, because this is like a story to literally tell our grandchildren and children of grandchildren of, this is a story for the legends, so walk us through it a bit.
Yes, so basically I come from the health development side.
Yes, okay.
Sort of. So as you said before, we already, of course, had systems which one of the most important tasks during COVID was to make sure these were up and running, and they were kept up and running, such as My Health, which is a citizen-facing portal, which doctors use to give care to their patients. It was important to keep it up and running, plus make it COVID ready in terms of notifications, in terms of...
Like what notifications, Nick, if I may ask?
The first phase of, especially in the first phase of COVID, of course, the most important thing was to isolate cases, to keep people at home, and at the same time to also notify people that they're not positive. So the first thing we did was to implement a robust notification system to let people know either that they should stay at home or they can return to work, basically.
Yeah, in fact, I remember that MITA upgraded their notifications portal throughout the pandemic. My goodness, how many things did you upgrade? You have now a cyber security center, which was previously, I got to know actually it was an old garage, but it was repurposed for the cyber security and made into a top-class facility. So really great job there, reusing and making things better. But Nick, I interrupted you a bit in your story. You were talking about My Health.
I started the story from the wrong end. So yes, basically, throughout the different phases of the pandemic, we had a system to accompany it, basically. So to start from the very beginning, as I said, we had first the focus was on isolating cases, etc., and that was our where we set up the notification system. At the same time, MITA was very important in mobilizing workforces, government workforces, and when we say government, we mean even healthcare workers, etc. And we helped in even moving radiographers, so they started looking at images from their home. So everything was being done from that was a lot of work, both from the health team and from the infrastructure teams. Then, as more testing was needed, MITA was involved in setting up the different testing hubs.
Yes.
And with that came something you described earlier on today, the dynamic system, where the booking system for tests and the case management system came with it. Then throughout the summer, when there was the sort of reopening, we worked on and you were also involved in the contact tracing app, so we could keep track of cases without being without being not intrusive at all in people's lives.
COVID Alert Malta, right? Yeah.
Yes, COVID Alert Malta, and there was the second phase, which was across the EU as well.
Yeah.
Then the second wave came, sort of, and with it came also different kind of tests. People were getting tested with rapid antigen tests.
Yes, tell me more about this, Nick, because you had, now when I look at it, the COVID results submission portal, which you're just about to mention, I now see it as a huge win in many aspects. So imagine all of a sudden now we've created a platform which enables health professionals of all kinds, not just doctors, but it could be, for I know, a physiotherapist, it could be a biomedical scientist, all these different people organized all in one place, and they have now the capability if legally needed to notify an infectious disease, that they can actually notify that. And so I can see a future where the COVID results submission portal is not just for COVID.
Yes, yes. Basically, we were in a situation where citizens were sort of evading, they were getting to know themselves that they were positive
Okay.
and that they were being tested. But there was a situation for a short period of time where they were sort of evading public health. A legal notice was issued so that that the public health is notified, and that at the same time we prepared this system, as you said, that can be used by all clinicians. And that portal now is also, the data that is being collected from there is now also serving as a data source for digital green certificates, especially for negative swab certificates and for recovery certificates.
That's fantastic.
And this ties to the previous presentation where they were talking about interconnecting health systems.
So this is the role of government, and that's very interesting when I look at it. The role of government is to consolidate where needed. For example, an EU COVID certificate. The private sector didn't need to create the actual certificate because they are not the experts, so to say, but the government was the expert of creating the EU COVID certificate. And that's where it came in, to consolidate all efforts to make sure that there is a standard and to make sure that the citizen is served at the end of the day, even if they did the test with a private testing center. So that was fantastic, really. That shows how we can be extremely visionary in multiple aspects. But continue with your story, Nick.
Yes, yes. After that, then came, of course, more testing, etc.
Yeah.
And then the vaccination campaign started, which involved multiple stages as well. First, and multiple processes. There was, of course, we have an immunization system in Malta, but it was not planned in such a way to call every citizen to come and being vaccinated.
Wow, all right.
So we needed to think about how to call people in batches and then how to be able to be flexible as well. That was one process. And then, of course, in parallel, it was important to make sure that no records are lost, because we were thinking about that this data then needs to be used as proof of vaccination.
Indeed.
We also built a portal which was vaccine.𝐂𝐸-𝐷.
Yep.
We took the approach, government took the approach of inviting people to show their interest, mostly to avoid as well wastage and time. And then sort of the digital green certificate. So that's the sort of final part of the story.
Yeah.
And now we're at the booster stage, which is also we are thinking of how we can, of course, reuse our systems to capture the booster.
I'd love to see my third dose actually on the actual certificate. I think there's a good role for it. The Israeli vaccination certificate is already updated with the third booster dose, so might as well start soon enough.
So that's basically the story of MITA. And of course, I come from the health development team. As I said, MITA was involved throughout the pandemic in different areas. When there was telemedicine being pushed, we set up a special support team.
Wow, all right. So
because
tell me more
of
about
course
it
was, as a government agency, our role is also to educate and to support people in going digital. We were lucky that just before COVID, MITA implemented Microsoft Teams application across government.
Yeah.
So people were already used to it. But then when it was the must, and doctors, etc., started using it, MITA set up a small team that you could actually, they were focused on giving team support to doctors.
But if I may ask, I think now this team is not so active anymore. Is that correct? Or they are less active, right?
Yes, they're less active. I think if you need support, you can still find it, of course. But throughout the pandemic, people learned that.
But that shows a big thing, because people learned, and then they needed less support, and then the system could scale up further. So that's really fantastic. It really shows how MITA really and truly understands the needs of the users, especially in these situations, especially in a situation where we didn't really know everything. So that was something that I think we've really learned on. And I want to kind of ask a direct question to you, Rob. So, did MITA notice new and emerging cybersecurity threats and vulnerabilities as a result of the COVID-19 pandemic? How were people kind of tricked, possibly, or even government employees?
Yes, in fact, we've seen an influx in a number of scenarios, mainly with the case of business email compromise, where you have attackers spoofing, and we've seen them basically high-ranking government officials, either tricking them in disclosing information, and also possibly even involving financial transactions.
Ah, that explains that yellow bar I had at the top of my email. All right.
In fact, if I'm not wrong, it was also introduced during the COVID period as part of an awareness initiative. Unfortunately, we did have some victims for these kind of attacks, mainly because people weren't working in an office environment with colleagues, where usually they bounce off some concerns or dilemmas. So we had that solitary factor. People were working like in solitude, they couldn't bounce off certain queries. Unfortunately, that brings up a specific vulnerable situation. And obviously, combining that with the surge of these, we can call them phishing attacks, you don't have the right recipe for surviving such attacks. We also had issues with people working from home and not using government approved devices.
All right.
We're seeing a lot of people using their home devices and connecting to the corporate government network. And that created a number of issues. Obviously, we had to control the situation. There were highly sensitive areas where we locked the access through only specific devices. We provided platforms where users who unfortunately ended up working from home and didn't have even time to collect their laptops because of the social distancing fear, and because also they were in a kind of banned from entering the offices. They had these platforms that we call secure administrative hosts, where they could hop on them. We had our monitoring solutions, and they could access both the government network and also highly sensitive solutions to continue their work. But also situations where even if government employees used their government devices, we're still in a phase where we are rolling out our monitoring solutions to monitor suspicious behavior coming from government devices. So what we did is we focused more on the health solutions. We had a team specifically also with the help of our internal health team that assisted in the onboarding of monitoring solutions, because if you don't have visibility, you cannot manage vulnerabilities. You cannot manage suspicious behavior. And apart from that, we had also threats coming from malicious software, malware. Unfortunately, the cases that we've seen came from third-party suppliers, and it usually boils down to having lack of resources focused on the security aspect. So we have teams which have a lot of ingredients, but unfortunately the security aspect is lacking. And what we did in that aspect is that the MITA security consultancy arm reached out to these teams and provided assistance for response and recovery, so that no systems would be impacted, or to contain the impact. And again, due to the influx of the need to connect remotely, we've seen unapproved software, people using different kinds of software to communicate, and that created a lot of issues because there were outdated software, vulnerable software, and we tried to control that by basically restricting which software runs on the government network and also on the government devices.
I have to admit, I've been working with the government for the past 9 years, actually, believe it or not. And one of the things that I've noticed is how MITA and the technology services have evolved. So I remember kind of kicking off my journey with using Office 2007. But now we're talking about Office 365, we're talking about Teams, we're talking about integrated software, we're talking about like visionary stuff. And now it's the challenge that I'm kind of noticing is that MITA's moving so quickly, you know, that updating, like keeping things moving, keeping things innovative, that sometimes people are, what is this new thing installed on my laptop? What did they do here? So now that is the next big change for MITA to get, and to try to understand the employees' mental models. This really struck me today. A fellow colleague on another panel mentioned this, and embrace this mental models of the employees. Kind of bring in also now with the remote working policy coming in. And in fact, I'm extremely curious to know how did the Teams scores explode from March 2020 to now. I think that number must be phenomenal. Before I was in a situation where I barely touched Teams, and now I am in 10 to 12 Teams meetings every week.
Mind you, at some point in time during the pandemic, even the Teams infrastructure provided by Microsoft had a period of downtime due to the influx of load that even they didn't forecast.
Wow.
So I think that basically answers your question because yes, we've seen a lot of people at least utilizing software which we are comfortable with, and fortunately enough, and I think hand on heart, we can say that the remote software for people to communicate over the internet, we had that project already implemented, and we were basically at least saved from the hassle of trying, testing, implementing something during a crisis situation, which is not ideal.
In fact, for example, for the telemedicine center, what was really great was that the electronic patient records were implemented right on time. So they were done. And Teams was also implemented right on time. So what happened? Both tools were available. A telemedicine center could scale, and now we have more than 200,000 consultations at the telemedicine center, primary healthcare. More than 200,000. That's no joke. So imagine, let's say half of them were Teams calls.
Yes.
Not just like simple telephone call. Just think about that. But we have a bit less than 90 seconds to go. So I wanted to each of you take 45 seconds to come up with the lessons learned from this pandemic. We'll start off with Nick this time.
Okay, there are many lessons learned, of course. I think in terms of, I come from the development side, one very useful thing, it is, what you really appreciated is prototyping, how important prototyping was for us, because we needed systems to be ready next week.
Yeah.
And we needed 2 systems to be ready next week, so we prototyped in parallel and we chose the features to go first. So that was very useful, and of course, the pandemic was an opportunity for us to really get into making use of Azure that the government of Malta invested in and make full use of it. So those were 2 important points for us.
Rob?
Yes, 2 points basically. First thing is we need to evolve, transform, something that I've heard during one of the sessions, or die. And I think one of the survival things that the Maltese citizens could feel is that here in Malta, at least, from a solution perspective, the government was able to adapt to a crisis situation. And also, another thing is that you don't take things for granted. We used to do things differently previously. We used to have people on site performing support. We used to push security configurations on government devices while devices are connected to the network. We do things differently now. So yes, you need to continue to evolve, not only through crisis situations, but you need to think in a preemptive manner.
Thank you very much, Nick and Robert. And with that, I would like to invite you actually to some drinks at 𝐿𝐴 Bar Hilton, which will be hosted by Modo Head. And they're going to start just now. So see you there. Cheers. Thank you, everyone.